Marika, can you show us how you're doing the new vDISCO protocol?
Yes, sure. So vDISCO method, vDISCO protocol is our latest protocol from our lab, and has so the main strength is that we are boosting the fluorescence signal and we are moving to far red, so we can reduce the autofluorescence coming from the tissues like the muscles. And very important thing is that we can image through the bones and through the skull, so everything is kept intact.
Yep. So can you also tell me the principle behind this vDISCO protocol?
Yes, so it's quite simple, because what you have to do is to pump your boosting solutions inside the body of our mouse, and also and then in the end we cleared our mouse. So how does it work? First of all, you have to prepare your mouse, but this is standardized because you just perfuse with PBS to wash out the blood, so it's the standard transcardiac perfusion. The second step is to perfuse with PFA in order to fix the animal, and then when you see that the animal is quite stiff and it's quite hard, then you can stop it and you put it overnight fixation at 4 degrees with 4% paraformaldehyde. A trick that we use during the PBS perfusion is to add heparin. So in this way, we can prevent also the formation of the blood clots, and we can wash out the blood perfectly from the body of the animal. When the post-fixation is done, you have your animal that is ready to use for the boosting protocol, or if you want to use it after some days or some weeks, it's absolutely fine, because you can keep it in your cold room at 4 degrees in PBS plus a little bit of sodium azide. It depends how much you use in your lab, for example 0.05% or 0.02%. And when you know that your animal is ready, the first step is to perfuse with PBS to wash all the dirt, some fur, some little pieces of the tissue away. The second step is to decolorize the animal with a decolorization solution to remove the remaining hemoglobin from the body of the animal, and the solution will turn yellowish. The third step is to decalcify the animal using decalcification solution to make the bones permeable. And then the next step is to perfuse with an immunostaining solution, where you have your booster inside, and it will circulate with high pressure inside the body of the animal, and you can also increase a little bit the environment temperature. I will show you later how. Then, after all these steps, you can wash out your remaining unlinked booster, and you can go for clearing. Clearing is done separately. It's not exploiting the transcardiac perfusion anymore, but it's done inside a chemical hood, because we are going to use organic solvents.
Thank you, that was quite straightforward. Can you also show me how you manually set it up?
So, you can see that the setup is very simple. You just have a peristaltic pump that will push the solution from a glass chamber where the mouse is immersed in, and then it will pump this solution inside the tubing, and then from the other side it will push the solution inside the heart of the animal for transcardiac perfusion. So here I have the setup to show you. So the pump from the company is coming with this, this clip, and then you have this black tube, and then you can connect with the two connectors here and here to other two transparent tubes that are resistant with our solutions and also clearing solutions. Here we have a needle with a blunt end, so this is not sharp, which is connected to the tube through the tip of a 1 milliliter syringe. And when you start the pumping, you will keep the pressure a little bit higher than what would you use normally. So this is the 50 RPM using this Ismatec pump. With our previous protocol, with the vDISCO, we kept the pressure around 25 RPM, but now we increased to 50 in order to push our booster in all the areas of our body. So again, you can see that here we have a glass chamber with the animal inside, and we are fixing the tubing with a needle with these sample holders that you can simply find in your lab. It's up to you which one to use. You have this one or this one. And how does it work? So it's like changing the water of an aquarium. You just have to put your first solution, you suck it out with a serum pipette. And then when you discard your trash solution, you can move to the next one. So it's like literally changing the trash solution, taking it out, and then move to the next solution. And of course, every time that you're changing your solution, you have to stop the pump. In case that you already changed the solution, then the pumping will be constant, okay? So here in this case, I said we started with the PBS, and let's pretend that we are pouring our solution here, like this. So it's very simple. You cover the body of your animal, like this. And if it's necessary, you can also add some drops of super glue to keep the tip of your needle in place, and also to seal the needle and the heart. I will show you this later, how it works. So let's say that now we start the pumping. You can see that it will pump the solution inside the heart, it will circulate. There are some tips to understand whether the solution is really going inside. You will see the heart like swelling, and also the lungs. And then after the first PBS washing, you simply suck it out like this. And you can discard it in a, in a beaker, and you will discard the waste according to the regulations of your institute. And the next step would be to go, as I said, with the decolorization solution. So this is just simply 25% of cubic reagent 1. You will find all the recipe in the online protocol. And then it's quite simple, because again, you pour this inside here. You pump, pump, pump until the solution turns yellow, because since it's a decolorization solution, it will extract the heme. The heme has the heme has a yellowish color. And as soon as the whole hemoglobin is washed out from the animal, the solution will turn yellow, and then you can discard it. And your animal will become a little bit whitish. This will run for 2 days, and then you wash the cubic with the PBS, you discard the PBS, and then you move to the next one, which is decalcification solution with a calcium chelating agent. Again, the principle is the same. You start the pumping, it will pump and circulate for other 2 days. You wash it with PBS, and then you add your immunostaining solution with the booster. You pump with 6 days. This is a very critical step when you're doing the immunostaining step, because after decolorization, the spleen of your animal should turn from red into light pink color. So in this way, you know that your pumping was accurate and the solution was going everywhere. Then, during the immunostaining step, you can also increase the environment temperature a little bit using this infrared lamp. This is a normal lamp that you can find in shops like Mueller or Rossmann. It's used to irradiate your body with infrared, so for example for muscle pain. But in our case, we are just using this lamp. So this lamp, you can put it like this distance from the chamber. You can cover the chamber with some aluminum foil, desired size like this, and then you make sure that the light is coming from the side. And you can keep it on for, during the daytime. You turn it off during the nighttime because this can overheat, okay? And then at the end, after the immunostaining step, your animal is ready to be taken out, and we put it in a 50 ml Falcon we add extra booster. We put it in a big incubator at 37 degrees to shake for extra 2 days in order to make sure that all the boosters are going everywhere in the body of the animal. After 2 days, you can get your mouse out from the incubator to put it back in the chamber. And then now you will pour your washing solutions here. It will pump again for 1-2 days. And then your animal will be ready to be cleared. So you can just take out the needle, take out the tube, get your animal, put a glass cover that is normally sold together with a glass chamber, and then you can move to your chemistry hood. So yeah, to use the clearing solution and safety, of course. The last trick is, if you're not sure if your solution is going exactly inside and pumping well, if you're afraid that it's coming out from the hole of the heart, then as I said, you can use the super glue. And then at the level of the entrance of the needle inside the heart, you just put 1 or 2 drops. You let it dry so it can seal the needle to the heart. And after some days, this will get hard, so it's also easy to remove afterwards.
So now you showed me how to stain my sample, and can you also show me how to clear it?
Yes. So the whole body clearing in this case is very, very simple because you don't even have to set up the whole perfusion system. But a glass chamber with your animal inside and a lid is enough. How does it work? So let's say that you just finished your immunostaining. So you get a waste container and you can just pour your trash, can be the previous PBS or whatever solution. Then let's say that this is a solution for the first clearing step, the dehydration step, the 50% of THF. What you have to do is to pour it inside the chamber like this. It's gonna be around 250 ml, 300. The important thing is that it covers your animal. And then you put your lid. Now it's ready for incubation. So you need a big rocker like this, with the surface protected for spilling, etc. And you leave it here, and it will shake, 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 shake for the needed time. In this case, 12 hours, 8 hours. When it's ready and you have to move to the next step, then again, you do as we did before. You pour the trash solution like this, and then you add the next one. That in this case will be 70% of THF until it reaches it. So these steps will run for 2-3 days. Here you can already see some examples of the cleared animals. And then later I will show you how finally the cleared animal will look like. Because you will see the transparency only in the very last step when we match the refractive index. And a very important trick is that because we are working with organic solvents, and you know that they can dissolve the ink of your pens, so yeah, use paper labels and always put some transparent tape to cover your label. Yeah, classic transparent tape. Okay, finally, after so many days of work, after immunostaining and clearing, this is the final result, the transparent mouse. You can see that the tissue has been decolorized and the animal is barely visible. everything is well cleared and transparent. In this case, we kept the eyes, so they are still visible because they have a lot of pigment, and they will stay in the black color if your animal is, for example, from a black 6 line. During the sample preparation, you can, however, remove them. It's not a problem. So here in the gut, you can see that some parts are perfectly cleared. If you see some dark parts like this, it's not because the tissue is not cleared, but it's just because of the feces content. So the food remaining in the gut.